a moment to thank Mina, the pharmacy manager here, for welcoming us to his pharmacy. Every day, but especially throughout the pandemic, pharmacists like Mina play a vital role in keeping our communities healthy and safe. We are truly grateful for the incredible efforts and dedication of Ontario's pharmacists and all our frontline healthcare workers. Throughout the COVID-19 pandemic, our government has continued to take a cautious approach to protect the health and safety of Ontarians. Thanks to this, we have made significant progress in our fight against this virus and charted a path forward to gradually and carefully reopen the province and manage COVID-19 for the long term. This includes closely monitoring public health trends to ensure that at every step, Ontarians are safe. So it was out of an abundance of caution that the decision was made to pause the lifting of capacity limits in some higher risk settings. This will ensure that we can continue to move forward, not backwards. In line with our cautious approach, we are enhancing COVID-19 testing by expanding the number of locations and making the tests more convenient to access for those who need them. These initiatives will add another layer of protection as more people head indoors during the winter. In the coming weeks, we will be rolling out a number of testing strategies. This includes increasing access to publicly funded testing in select pharmacies for all eligible Ontarians, including individuals who are symptomatic. These services include on-site testing and take-home self-collection kits that can be picked up and dropped off. Pharmacies must opt in to provide these services and will be required to follow stringent infection prevention and control measures, and services may vary depending on the pharmacy. I encourage anyone who needs a test to use our COVID-19 testing locator tool to find out where you can get tested and what services are available. In addition, we are also expanding the use of rapid PCR testing in select assessment centres and pharmacies across Northern Ontario to increase access to local testing and provide quicker results. Finally, we are bringing asymptomatic testing directly to Ontarians. To reduce the risk of transmission over the holiday season, we will be launching a pop-up blitz in higher traffic public settings, such as malls or holiday markets, to provide testing to individuals without symptoms, as well as provide vaccine education. These sites will be announced in the coming weeks. Our enhanced testing strategy will help to ensure that every Ontarian, regardless of where you live, can access testing closer to home when you need it and get a test result as quickly as possible. Now, before I hand it over to Minister Lecce, I know there is a lot of excitement around the availability of vaccines for children aged 5 to 11. There are reports of Health Canada approving the Pfizer vaccine for use in that age group as early as tomorrow. This is, of course, fantastic news. I know approval will be a huge relief to many parents and represents a bright light at the end of the tunnel. We know the Pfizer vaccine for 5 to 11-year-olds requires new product to be received from the supplier. We've been assured that supply will be provided to provinces and territories by the federal government in the days following Health Canada's approval. It could take anywhere from a few days to perhaps a week before we receive doses. And rest assured, we are working very closely with the federal government to ensure that we receive Ontario's supply of the vaccine as soon as possible. And I can promise you, we are ready. As soon as we receive the 5 to 11-year-old supply from the federal government, our public health units and local partners are ready to receive and administer the Pfizer vaccine. Over the coming days, you can expect to hear more from them on how they plan to roll out the vaccine through their local channels. This includes mass vaccination clinics, primary care, pharmacies, and of course, school-based clinics. The provincial system will be available to parents to book appointments for their children, and we are looking forward to sharing those details following the approval. We also know that some parents may have questions about the vaccine, and of course, that is totally understandable. We are working very closely with our public health units, our children's hospitals, and other health experts to ensure parents can get the answers to their questions. This includes partnering with Sick Kids Hospital, for example, to allow for confidential, convenient, and accessible vaccine consult services for children, youth, and their families. And as soon as we have supply, we will be ready to get shots into arms and provide an additional layer of protection to keep our children safe. That is our fundamental primary concern. So thank you. And at this point, I would now like to pass it over to Minister Lecce to provide more details about our school testing program. Thank you.
Well, good afternoon, and thank you so much, Minister Elliott. Of course, Dr. Moore, Ontario's Chief Medical Officer of Health. It's good to be with you both. Now, since returning students across Ontario to full-time in-person learning, our government has been laser focused on keeping schools safe and open. It is why our government implemented a cautious plan that puts the health and safety and the well-being of our students first. Our plan has been fully endorsed by the Chief Medical Officer of Health, is supported by strong investment, improvements to air ventilation, and some of the highest rates of youth vaccination in Canada. More than 80% have received 2 doses today. As a result, we've been able to keep students learning in person while restoring activities like sports and extracurriculars critical to the mental health of your children. Now, to protect this progress, we must remain vigilant and to protect the health and the safety of students by expanding testing options, by providing boards with access to additional resources. We will further protect students and continue to support safer in-person learning. Now, with the full support of the Chief Medical Officer of Health and recognizing the high rates of immunization amongst youth in our secondary schools, I'm proud to announce that secondary schools will resume a regular timetable model of 4 courses a day starting in term 2. If a school board has the support of their local public health unit to change their timetabling, that approach could happen sooner than February, sooner than term 2, and they could resume that model prior to the start of the winter semester. Recognizing that our youngest students, on the other hand, are not yet eligible for the vaccination, but as the minister has mentioned, that may be imminent, we're introducing additional temporary measures to protect them as the winter months approach. On the advice of pediatric leaders and the Chief Medical Officer of Health, and to allow for a bit more time to get the youth vaccination rollout underway, elementary schools will be required to move to virtual-only school-wide assemblies starting in January. And out of abundance of caution, elementary schools will also need to restrict lunches and breaks to classroom cohorts when indoors, where distancing between cohorts cannot be maintained. Now, this is to support all schools and all students. As of this week, our government has been providing take-home PCR self-collection kits. They're being shipped out to school boards right across Ontario as we committed to all publicly funded schools for eligible students across all grades. In protecting the hard-fought progress we have achieved, we've tried to make the experience of COVID testing as simple, as accessible as possible for parents and families, with the aim fundamentally of keeping children in class. Now, we're pleased to confirm that students will be able to pick up the PCR self-collection kits at their school, complete the specimen collection at home, and drop off the kit for processing at hundreds of participating community locations, including pharmacies across Ontario. And to make life easier for parents to take a step further and to ensure students safely return to class in January following the holidays, we're also pleased to announce that all students will be receiving rapid antigen screening test kits to bring home and to use. Between late November and mid-December, we'll be distributing 11 million rapid antigen screening tests to all publicly funded schools ahead of the winter break for students to take home to help ensure a safe return in January. This will support a safe return, as noted, by enabling widespread access to rapid antigen tests, given the potential risk of transmission due to the increased gatherings indoors over the holidays. However, I want to be abundantly clear. Testing is not a replacement for vaccination. That has been a critical fight against COVID-19. Now, we're allowing boards as well to access the remaining portion of the $1.6 billion that we provided to them to help protect schools, to hire staff, and to ensure kids can learn in a safe environment. These resources have been key to our fight during this pandemic, and they include investments like mental health, the hiring of hundreds of teachers and staff, school-focused nurses in our public health units, and additional safety measures to keep school transportation safe as well. And it demonstrates our commitment to a cautious approach to in-person learning so that we can continue to make progress. Now, to recap, we take nothing for granted in this government when it comes to keeping schools safe and open. And so we are following the best advice and taking additional action by providing all students 5 rapid antigen tests to take home over the holidays. We're providing access to the remaining $1.6 billion of COVID-19 resources to hire more staff, to increase mental health support, and keep schools safe. And we are enhancing the protocols amongst largely unvaccinated elementary students, as well as providing accessible locations for all families to drop off their take-home PCR test specimen. Nous augmentons les tests de dépistage, les investissements et les protocoles pour veiller à ce que les écoles restent ouvertes et plus sécurité. And I want to express my gratitude to Minister Elliott, to Dr. Moore, and to all of our school communities for their partnership in keeping kids safe and staff safe, and part of the broader commitment to support parents by minimizing disruptions for Ontario students. And I also want to recognize students across Ontario for their leadership and advocacy and the strength they've demonstrated over this period. I want to give a shout out to the Ontario Student Trustees Association, who I met with this morning, who've been strong advocates for this type of change, including the return to normal semestering. Our students are leading by example. And as a result of their act and Ontario's cautious safety plan, we have one of the highest vaccine rates and one of the lowest case rates for youth under 20 in this country. Today's investment and the testing expansion will help maintain our momentum to keeping our schools safe and open. And with that, I'll turn it over to Dr. Moore. Thank you.
Thank you, Minister Elliott and Minister Lecce, and good afternoon, everyone. We continue to closely monitor and assess key public health indicators across this province. While we have seen an increase in the number of COVID-19 cases in Ontario, our province continues to report one of the lowest weekly rates in the country, and our hospital and intensive care capacity remains stable. However, I want to continue to emphasize that we should never underestimate this virus. We all have to remain cautious, prudent, and disciplined. It is critical that we remain vigilant as we head into the winter nights and continue to follow the public health measures that work. Wearing face coverings properly, maintaining good hand hygiene, practicing physical distancing, staying home if you are ill, and getting tested if you have symptoms. I want to thank all Ontarians. Our system is working. It's keeping all of us safe. And of course, thank you to all Ontarians that have come forward to get vaccinated. Today, we're at 88.8% of eligible Ontarians have got their first dose. We have safe and effective vaccines that continue to protect our communities and our loved ones. We must protect our progress. Getting vaccinated will help us recover more quickly as a population by having the highest immunization rate that we can achieve as a province. And just a reminder for all those that are eligible for their third doses, those that are transplant or immune suppressed, those that are healthcare workers, those that are over 70 and our First Nations Inuit Métis citizens, please come forward and get immunized if you're eligible 6 months after your last dose. Ensuring consistent and timely access to testing is another key step to responding to potential outbreaks or surges of COVID-19 in Ontario. We expect a great partnership with our pharmacy experts, just as we have throughout the pandemic, and will continue to ensure that they have an effective prevention and control protocol in place to keep their patrons and staff safe. As we prepare to head inside over the winter months, enhancing our testing strategy is critical to protect our hospital capacity, our healthcare resources, and the progress that we've made together. Over the same winter months, we will continue our work to proactively improve our vaccination levels. As the Minister has said, we expect Health Canada to approve the Pfizer BioNTech vaccine for those aged 5 to 11 very soon, and we will work in lockstep with our local public health partners to quickly roll out these doses. We are prepared at a local level for this rollout. As the provinces manages COVID-19 for the long term, the ultimate goal is to ensure a balanced approach with the least amount of disruption for people and businesses. We cannot take our hard-fought progress for granted. We all have to stay cautious, disciplined, and continue to work together. We want to continue taking small steps forward and not backwards. We must protect our progress. Thank you.
So we'll now go to the phone lines for questions. Just a reminder, it's one question and one follow-up. First question.
From Matthew Bingley at the Global News.
Hi, Dr. Moore as well as Minister Elliott. I'm wondering if you can explain to people how in one sentence you can say stay home when you're feeling ill, and in the second say come to a pharmacy to come and get tested if you're symptomatic. And I'm wondering also if you could please outline just how specific you'd like to see the division of a room in those pharmacies that are approved. Is a plexiglass divider okay for you, or does it have to be a separate room?
Thank you for the question. So we've worked with Public Health Ontario, the College of Pharmacists, to be able to provide advice for infection prevention and control. We've got an extensive guideline that will help guide pharmacists through the process of establishing testing for symptomatic individuals. That should include a separate entrance, specific distancing, the placement of a medical mask if they don't have one as they enter the pharmacy. The appointments should be booked in advance, and the staff will be all prepared to have best practices for infection prevention and control. It should be a separate facility or space from their normal prescribing, from their immunization area, and all that is outlined in our guidelines in partnership with the Ontario College of Pharmacists, Public Health Ontario. We have over a year and a half experience now in providing assessment and testing, and we think we can do this in a very safe way. It's very important for Ontarians to have accessible and available testing in a rapid turnaround time, and making testing available through our pharmacists is just one additional strategy that will only further protect Ontarians. I think it's very important to have these in play. I think they can be done safely given the experience that we already have, and I absolutely will work hand in glove with our pharmacy partners to make sure that they remain safe as venues for testing. I have to thank them for stepping up and further protecting Ontarians. They've been immunizing for influenza, for COVID. They've been handing out testing, doing asymptomatic testing, and now they're progressing through the point of providing symptomatic testing. It's just one more tool in the armamentarium to further protect Ontarians. It's so important to get timely testing, and have to thank them for stepping up and further supporting Ontarians at this difficult time.
Follow-up.
For the approval of 5 to 11-year-olds, which is expected tomorrow, do you have a plan that you're going to release that will have best practices for public health units, or are you going to leave it up to them? And will these vaccinations occur in schools?
Well, first, the first part of your question, I can say that Dr. Moore and his team have been working with all 34 local public health units to understand what their plan is for the vaccination of children aged 5 to 11, and that plan is ready to go. Some of the details of those plans have been released by local public health units, Toronto being an example, and we anticipate that the other units will be releasing them very soon so that parents will know where and when their children can be vaccinated. And we expect to have our provincial booking tool up and ready very early next week so that parents can make those appointments.
Next question.
From Mark McAllister at City News.
Good afternoon. With regard to the number of pharmacies that are going to be involved, how have you assessed 600 at this point, up to 1,300 that will actually be taking place? And just to follow very quickly on Matt Bingley's question, there's lots of room for interpretation when it comes to these measures within the pharmacies themselves. How do you assure that these pharmacy locations are going to be in keeping with what you just described in those separate spaces?
Well, we've been working with a number of pharmacies for many, many months now, so we do have some information already existing about their abilities to deal with the symptomatic individuals that may be coming into the pharmacy. We know that they will need to opt in. Some will not be able to just because of their physical structure. They are able to operate outdoors, to have drive-in centers. But of course, that's not realistic for many urban locations, but that is possible for them to do. It is also possible for people to have someone pick up the test and bring it home for someone who is symptomatic. A parent, for example, might be able to do that. In terms of making sure that the pharmacies are following all of the rules, we continue to have inspectors out there that are looking at workplaces. We'll continue to do that, but there's also the College of Pharmacists that have very strict rules for operation, and that they already are working with individual pharmacies to make sure that they understand the rules and that they will be following them. So that is a very important way to make sure that the requirements are being followed in all of the pharmacies that choose to opt in.
Follow up?
And with regard to the vaccination for kids starting tomorrow, or being approved tomorrow, the interval of shots at this point is expected to be 8 weeks. That means fully vaccinated kids probably won't happen until February, and yet your reopening plan sees some of the restrictions being lifted in January. Is there a plan as a result of these kids not being fully vaccinated until February to maybe push back your timeline?
Dr. Moore?
Thank you for that question. I think the government and the Chief Medical Officer of Health Office have made a commitment to all Ontarians to review the data on the 17th of January. We, if there's any risk, will make the decisions together with government that would be responsive to data. I can't say where we'll be at in mid-January. I'm certainly optimistic and hopeful, but given what we've already done, holding back and pausing for the reopening that was to occur just a few weeks ago, I think that's a commitment that this government will be data-driven, won't increase the risk for any Ontarians, and will be prudent and never underestimate this virus.
Go to the next question.
From Holly McKenzie-Suter at the Canadian Press.
Hi, I have a question for Dr. Moore and Minister Lecce, if you guys can both answer. On the rapid testing plan over the holidays for all public school students, we do know that families have been asking for something like that for a while, but they want it to be throughout the school year for, more peace of mind as they're sending their kids to school every day. So I'm just wondering if you could explain why the holidays are this important testing period for every student to be eligible, and if it's something the government will consider doing once the holidays are over during the regular school year to kind of keep track of the situation, especially as...
Yeah, thank you for the question. I mean, the government has, since September to the present, systematically increased testing options for families, because what we're trying to do is reduce the pressure on parents and increase the presenteeism of children within our school system. So back in September and thereafter, we launched a rapid test program that public health units can deploy at any point to any school in any region of Ontario based on risk. We then, of course, expanded to a test-to-stay program designed to minimize the disruption to learning for children because of potentially an outbreak in a school that could compromise the learning of the other kids. So a new protocol was developed in conjunction with the Chief Medical Officer of Health, the first in Canada of its like, to arm public health units with that capacity, testing, and guidance to protect in-class learning. And then we expanded the PCR take-home test to all children in Ontario, available at all points through the school year. Again, designed to reduce the time it takes for a parent to get their child assessed and get the test result, because that 2 or 3 days could mean, an opportunity for those kids to be in class learning where we believe they belong. We're the only province to have the take-home PCR test at a province-wide scale. We're proud of that. And today we're expanding upon those options, really understanding, based on history, last Christmas, last holiday, the potential transmission that can happen around the holidays. And so, out of abundance of caution, to ensure children return to school in January, and also to reduce any anxiety for parents, given that period of time and what will probably happen over the holiday, we thought it'd be prudent to provide 5 rapid test kits to children, all children in Ontario, really premised on the objective of getting them back in January. We'll continue to follow the best advice of the Chief Medical Officer of Health, the Ontario Science Table, and Ontario Health with respect to testing, keeping in mind that for any individual that has a symptom over the holidays, they should go get a PCR test. These are made for asymptomatic purposes for children within our communities, another way by which we're helping families and keeping our kids safe. Dr. Moore, okay?
Okay, so was Dr. Moore going to answer?
No, you could have your follow-up.
Okay, yeah, I was wondering, as part of that question, like if you're going to consider doing but my other question is about the vaccinations for 5 to 11-year-olds. If you're prepared to, I guess, commit today as to whether there will be in-school clinics that are accessible for every student before the December holidays start. If that's it seems like it would be effective to get it done before they go home for the holidays and have that option in their school. Is that something government's able to guarantee today?
I'll turn it over to Dr. Moore with respect to that process. I can just simply note that our school system, our school boards, and the schools themselves have been safe places for the safe vaccine for children in our high schools, particularly those 12 to 17. We've had great success in this province making the test available, reducing barriers, making rather the vaccine available and reducing barriers. Now, we have over 80% of students 12 to 17 are double dosed. That's amazing. We're one of the leaders in the country. We did use schools to help support that, 650 school-based clinics. They've been effective, and I, as the Chief Medical Officer of Health and Deputy Premier, have both confirmed schools will be part of those options for families when it comes to vaccines for the youngest learners. But I'll turn it over to Dr. Moore for more.
Yeah, given the variable geography across Ontario and there are 34 existing plans. We have reviewed them centrally. We've been working with our health units for the last several weeks. Many of them do have in-school immunization plans, but they're multimodal. They're working with their primary care physicians, their pediatric experts, their hospitals, and they're running mobile clinics and public health run clinics on their own. So you'll see they've customized their plans for their population to make sure that the vaccine's accessible, it's available for families and children from 5 to 11, but it is absolutely customized. I think families, parents, educators will be happy with the plan, and I have to thank the health units that have worked so diligently over the last month to ensure that we can rapidly provide vaccine. We want to get that first dose in before the holidays, and then subsequently the second dose 8 weeks apart. That will best protect our families, decrease transmission in the school setting, help with presenteeism, minimize the burden on the health sector, and help us achieve that extra percentage or 2 of population immunity that's going to be essential to slow this virus down. So stay tuned. The plans will be released by each health unit in the coming days, and I think all communities will be impressed. I certainly am with the work that they've been doing at a local level, and thank them for all of their work. They know they have an important task ahead, and they're ready for achieving the goal.
Next question.
From Rob Ferguson at the Toronto Star.
Hello, everyone. Just going to change gears a little bit. We are on the cusp of people being able to go to the United States, for example, according to reports, for trips of less than 72 hours without having to get a test to come back. So I wonder, Dr. Moore, advice for this. The statistics in Michigan, for example, are horrible. About 7,000 cases a day, many hospitals full to the brim, and test positivity rates of 16%. So what's your advice to people who might want to go over the border and do some shopping or have dinner, whatever?
Well, thank you for that question. Yeah, it really is a risk assessment. Ontario remains one of the safest locations in Canada right now. At a provincial rate, our number's around 28 cases per 100,000. As soon as you go across the border to Michigan, New York, you're looking at rates of illness 5 to 6 times higher than ours in Ontario, and it may be higher in certain communities. So if anyone's going across the border, please do a risk assessment. Make sure that you're taking all appropriate precautions, that you're wearing your mask, you're performing your hand hygiene, you're distancing, because the risk as soon as you leave and go to the southern or the United States is higher than what we're experiencing now in Ontario. And if you're ready to take that risk on, please go ahead. Monitor your symptoms when you come back. Even 2-dose vaccinated, you can get COVID-19. It's a highly effective vaccine, but there is a small percentage that can get the virus. Monitor for symptoms. Get tested if you get symptoms, but please assess the risk.
Okay, thanks for that, Doctor. And getting back to today's topic, there's been quite a bit of blowback from some people in the health field about this symptomatic testing and pharmacies plan. What do you make of that, and did you expect it? Do you think you've addressed everything as much as you can? Because it sounds like there are still lingering concerns.
Oh, no, I can understand that people might have concerns. Though they may not have reviewed the infection prevention and control guidelines that we put in place. They may not have had the conversations that we've had with our pharmacy partners. They've been testing all along for asymptomatic, so they certainly have the infection prevention control down for those tests. We're now asking them to do symptomatic, and I have complete confidence that they'll do it safely. They'll follow the right precautions. And I've had individual conversations with many pharmacists who absolutely have share the same concerns of not wanting to have any spread within their workplaces. They're anticipating having separate entrances, separate spaces, and ensuring the safety of their clients. They're professionals, and they've been testing and working with us all along, and I have confidence that they'll continue to provide the safety within their work settings to best protect Ontarians. I personally, though, want to thank them for stepping up and making testing more accessible and available, knowing that their hours, they work 7 days a week, many of them have very extended hours, and it's going to be much more convenient for Ontarians. It's so important that we have accessible, available tests with quick turnaround time, and I think the pharmacy strategy, given that they're so dispersed across Ontario, only further supports our testing and assessment sites and can take the burden off them, and certainly take the burden off our emergency departments, where that would be one of the last places I'd want someone to have to go to get tested. So from a personal vantage point, thank the pharmacists for stepping up. From a consumer vantage point, I think it's going to be much more accessible and available, and I do believe that they have the safety in mind to adhere to all the best practices, and the local public health agencies and our infection prevention and control hubs can certainly provide further support to them. But thank them for stepping up and further supporting Ontarians.
We'll go to the next question, and this will be the last question.
From Jeff Gray at the Globe and Mail.
Oh, hi, thanks. I'll start off with a question for Dr. Moore there, just on that point there. You've mentioned a couple of times that pharmacies will be required to have separate entrances. In the tech briefing we got today and the slide, that phrase isn't in there, just as ensuring sufficient dedicated space. So is that something they're going to have? If I see a pharmacy that's testing symptomatic individuals, they will not be using the same entrance that I use to go in and get milk or whatever?
I didn't mean to infer that all of them would have that practice. It is a best practice to have a separate entrance for those that are getting tested, and that would be, if they have that capacity, the best means by doing it. We've also heard from some pharmacists that they would do drive-through testing outside of their facilities. So certainly in the United States, the major pharmacies have been doing this all along, supporting testing through multiple mechanisms. It's been a safe means means by which tests are provided. We've used their experience and are further applying it in Ontario. So I do think it can be done safely and that we can trust our pharmacy experts and partners to ensure that their clients remain safe and protected. Given that in these environments, everyone also should be masked. They should be distanced, and all of these pharmacies will be reviewing their ventilation, their air exchanges, their filtration systems, and ensuring maximum air exchange as well to further protect their clients and their workforce. So I didn't mean to infer that all of them would have separate entrances. That certainly would be an ideal.
Follow up, and this will be the final question.
Okay, and on the school, the rapid antigen testing, there was a back and forth about this with parents trying to get their hands on tests and so on just a month or two ago. And just over a month ago, the sort of background information that the Ministry of Health was putting out, and that you had put out as well, sort of said that widespread use of asymptomatic screen testing like that isn't recommended. So what has changed?
The major risk that we had is going into the winter months. And we know just today with 711 new cases, we can project what's going to happen in the winter going forward. So we're anticipating our rates going up. As the rates go up, the sensitivity of the tests is very good and the number of false positives will be less. As well, we know we're heading into a social season where there will be much more interaction at an individual and potentially at a community level. And because of the combination of the winter, the socialization, and the known increase in case counts that we're seeing, we think it's prudent, reasonable, proportionate to have those tests in the hands of families to be able to use to further protect them over the holiday season and to best detect early any cases before the return of school in the first week of January. So we do think it's evidence-based, that it's risk-based, and in many communities it's quite proportionate to the risk at present.
Thanks, everyone.